it is very important to connect antimicrobial resistance with universal health coverage because of multiple reasons. One is, antimicrobial resistance can drive up the cost of implementing universal health coverage. Antimicrobial resistance results in increased morbidity, increased mortality, increase in cost of medical care, increased health capacity utilization. All of this essentially translates into much more effort and cost involved with universal health coverage. The high-level meeting scheduled for September on universal health coverage, it's going to be a very important one in terms of multiple actors, multiple interest groups. The kind of universal health coverage we want, we should be able to define that. Right now in many developing countries, the focus is on insurance-based health coverage, not universal health care. What we really need is a universal health care based on primary health care and through strengthening of public health systems. We should be able to, as a group, we should be able to articulate that and get it out of the meeting. So I certainly believe it's a make or break situation, and the political commitment and the momentum around that meeting is going to have a significant bearing on the future of AMR and UHC.